I guess I'm always about raising the bar and what we do each and every day, and excellence every day is kind of my tagline, and they know that. And so how do we get to provide excellent care every day? And I always bring it back to the patient. That's why we are nurses. That's why we work in healthcare. It's got to be about the patient. So to take the best care of the patient, are you the best nurse that you can be? So do you have a specialty certification? Do you have an advanced degree? Are you working towards anything, or are you just status quo? So that was a culture shift of where they were to where we've headed now. And this council that did the Grow as a Professional Day was amazing. They got it, and so they shared their energy as well. And now, after doing this session here at AO&E, we're going to publish again. So and I look at big hospitals and they publish all the time, but that's a big deal for a small rural community hospital to be able to publish. So we're excited about that next step and raising the bar just a little bit higher. So I mentioned that our turnover rate for 2016 was only 1.2%, and I strongly believe that has to do with shared governance and also that shared decision-making, nurse engagement. I round every day. I talk to staff. My leadership team rounds every day. They're out there, they're visible, and they're part of the decision-making that happens with the patients at the bedside. So I think that's kind of the most important part. I don't think there's anybody that doesn't like a good celebration and a fun party to think about all the great things that you do, because every day at work isn't always a celebration. When you're holding the hand of someone who's dying and you're caring for someone who has an illness that's going to be devastating for the family, there is a lot of downside to that. It can be a good moment with the nurse and the patient and the family, but they need a work-life balance too. And so to me, it's important that nurses take care of themselves, mind, body, and spirit. And so having celebrations is just a way of me giving back to them, thanking them, and that's what I do. I have respect and gratitude for everything they do every day. No, you saw a slide of retention rates, and even though 16.4 is the national average, we were never higher than 8, and I think that's because of our geographic location. We did have some turnover because some of the nurses didn't like where we were going, and some of them just wouldn't get on board, so we did have a little turnover when we first started. But now the nurses that we hire are done with peer interviewing, so the nurses they work with interview them, and then they get on board, and I think it's the preceptorship, the mentorship, the onboarding process that gets them engaged from day one.